This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
There are a million things to think about and prepare for the moment you discover you're pregnant.
Well, I always tell my patients that pregnancy is not a disease. First of all, this is something physiologic. It is very important that these first-time mothers would be properly oriented on what to expect. The what's, the do's, and the don'ts.
You would normally experience many physical changes in your body.
Telling them the importance of having a healthy body first. Because if you have a healthy body, you will be the one carrying the pregnancy, then we expect a healthy baby also. So you advise them, of course, to eat healthy, regular exercise, folic acid for the brain, for the spinal cord. We also advise them to have vaccination before conceiving. Make sure that you have all this screening and making sure that you're healthy enough.
There are also many things to consider, like making smart food choices, maintaining a healthy lifestyle, and undergoing the necessary procedures such as a pap test and screenings for sexually transmitted disease.
Of course, we encourage you to have your regular pap smear, and then transvaginal ultrasound, and then, of course, breast checkup, no? To visualize the ovaries, the uterus, the fallopian tube.
This also includes checkups for your other health issues such as high cholesterol, depression, asthma, diabetes, among others.
To the women out there, you know, health is wealth. Even if you have the best family or family life and best marriages, what will it be if you're unhealthy?
What steps should you take to ensure a healthy pregnancy for you and your baby? How can you prepare yourself with the possible changes in your body? All these and more tonight on MedTalk.
Joining us tonight is Dr. Rose Castillo-Cheng, a perinatologist and a high-risk pregnancy specialist and a training officer of the Section of Maternal and Fetal Medicine of the Department of Obstetrics and Gynecology of the Medical City. Also with us is Dr. Nemi Reyes, the Department Head of Obstetrics and Gynecology of the St. Luke's, Quezon City, and a Fellow of the Philippine Obstetrical and Gynecological Society. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Happy Women's Month.
Same to you.
Thank you. Welcome to the show, Maternal Health. What
right.
is maternal health and how do you ensure maternal health? Dr. Manny?
Well, maternal health is the condition of the woman who is the mother that covers the physical aspect of the well-being, the status of the mother, emotional, mental, even spiritual. So it's just the whole person. And how do we ensure it? Well, that's a big question, no? Because, of course, it entails a healthy diet and enough physical activity so that, you know, there's enough exercise and medical assessment, vaccinations will come in, and some diagnostic tests. So this is as far as what the doctor can offer, helping the patient ensure that she's healthy.
Healthy prior to getting pregnant,
Yes.
and during pregnant, and after childbirth.
That's right.
So how important is maternal health, Dr. Rose?
The maternal health is usually something that we take as if it's quite simple, but it's actually a Herculean task to make sure that your mother and both baby comes out normal. Usually we start by taking a good history. We make sure that the patient knows if she's healthy or not. That's why a planned pregnancy is always a good thing to start with most of the time, not something that should not be, it should not be unplanned.
Ideally.
Yes.
Ideally.
If you have control of things, then yes.
If you can control, if you are control of your circumstances, and if you are prepared for it,
yes,
no matter what age.
Well,
not really.
Not really. Age is not something that should dictate how you will be prepared for pregnancy. I always tell my patients that when you embark on pregnancy, it's something that you should go into with a battle plan. Don't go into war without having any guns or armor with you, right? So it's something that you should prepare for.
Okay, and something that you should prepare for, you mentioned a battle plan.
Yes.
How responsible should a mother be when she's pregnant?
The basic responsibility will start with having to seek consult prior to conceiving, because you'll never be able to plan your battle plan if you don't know what you're up against. So that's the most basic, seeking pre-conceptional care.
Doctor, so seeking pre-conception care, but before we do that, we first have to find out if we are pregnant. So how does this happen? What do we do? What are the signs and symptoms of someone who might be suspected to be pregnant?
Yeah. There are so-called presumptive signs of pregnancy, probable, and positive signs. Well, among the presumptive signs would be, general manifestations like, of course, a missed period. One missed period may indicate the possibility of pregnancy, and of course, if you miss 2 periods, okay, after a first miss, a second period is missed, then the likelihood of pregnancy becomes higher. Also, nausea, vomiting, breast tenderness, frequent urination also. But there are other things that can explain those manifestations. So it's not only pregnancy. That's why they're called presumptive. There will be other signs when the woman starts noticing that her abdomen is becoming larger or it's enlarging. So that's, the likelihood of pregnancy then becomes higher. And of course, a positive pregnancy test, but you can have false positives, right? But when the fetus or the baby is demonstrated on ultrasound, or the doctor actually hears the heartbeat, or the doctor herself or himself is able to feel the movements of the baby, then those are positive signs. Then we're sure that that patient is indeed pregnant.
You mentioned the early signs and then the first signs of a woman actually being pregnant. How far along should a woman be in order to determine that she is indeed pregnant? Dr. Rose, Dr. Manny, how far along?
How far along before she knows that she's pregnant? As Dr. Manny said, the first week of
already?
Yes.
That's immediate.
But we have tests now wherein you can obtain a blood test. It's called serum beta HCG. It can be obtained as early as 1 or 2 weeks after your ovulation. You might not have any missed menses yet, but if you're so gung-ho in finding out if you're pregnant or not, then that's one of the ways by which we can check. It is elevated. It's very high when a patient is pregnant. It's 0 or less than 5 if a patient is not pregnant.
So a blood test instead of a urine test?
Yes. It will manifest earlier than a urine test. The hormone will not spill right away in the urine, but it will be present in the blood of a pregnant woman.
So it's better to get the blood test.
Well, if you can't wait.
If you can't wait, yes. A lot of want-to-be mothers, you know, they can't wait. They want to know right away. And we have a caller on the line, and I'm sure she has a very interesting question for all of us doctors. Hi, Beth. Beth Enriquez.
Hello.
Good evening.
Yes, good evening.
Hi, please go ahead with your question.
Oo, kasi I'm 41 years old. Right now, I'm taking
41?
maintenance for hypertension. Coaprovel to be exact.
Okay.
Is there a possibility na I would get pregnant again? I have an 8-year-old son na right now, pero would like to have another sana.
Okay.
Beth, you're 41, right? Did we hear that
Yes.
right?
Yes.
Yeah. You're still menstruating quite regularly?
Yes.
Are you menstruating well regularly? Yeah, the possibility of
Yes,
you
ma'am.
being
Yes,
pregnant, yeah, is there. Now, regarding your hypertension, of course, it would be best if this is well controlled, and then as soon as pregnancy is diagnosed, then we'll have to work with the cardiologist, both the cardiologist and we in obstetrics will have to work together to take care of you, and then maybe shift your medications to something that's acceptable during pregnancy.
Beth?
All right.
Beth, if I may ask, was your blood pressure also elevated when you were pregnant first time?
No, doc. Only after I've given birth.
Okay, is your blood pressure controlled right now?
Yes.
That's good. Usually, if your blood pressure is controlled at this point prior to getting pregnant, then that would mean you might have a good pregnancy still, although age in itself and your hypertension might be a risk. If you want to ensure that you will have a good pregnancy in spite of the hypertension, there are tests now that we can do to probably find out if you are at risk of having preeclampsia. Preeclampsia is hypertension in pregnancy. So there are tests that we can now do as early as first trimester.
All right. So, kasi, Doc, I'm worried because, I'm worried kasi I'm taking yung medication. What if I become pregnant while on medication? Without me knowing it, kunyari, biglang na-delay na ako, pero I'm still taking the medicine. What is the risk?
If you're already committed to wanting this pregnancy, that's why we would want you to go for preconception counseling. You can plan with your OBGYN and your cardiologist at the same time, so that if you're intending to start this pregnancy, you might want to shift the antihypertensive already to one that is safe for pregnant women. That's one of the things that you can do, so that you won't be apprehensive about taking something that might be teratogenic to your baby.
Beth?
Okay. Thank you.
You're welcome. Good luck.
Yes.
That's what you mentioned earlier, doctors, that if you really want to get pregnant,
Yes.
you have to take the necessary care already prior to getting pregnant. So just in case you are, then you know you've taken good care of yourself.
Yes.
We'll talk about preconception care and prenatal care when MedTalk returns. So she's just like...
Did you know that roughly 10% of pregnancies end in miscarriages? According to the American Pregnancy Association, many of these miscarriages happen when the woman involved does not even know she's pregnant.
We're back here on MedTalk, still talking about maternal health. Now, before we debunk some myths about pregnancy, let's just talk about preconception care and prenatal care. Briefly, this preconception care, how important is it?
Preconception care would mean you are not yet pregnant, but you are planning to be. So that will mean you'll still have to visit your OBGYN. The OBGYN will take a list of your past medical history, your family history. Have you been vaccinated before? Have you been ill before? It's a layout of the things that you might have to tell your doctor, which will likely affect the quality of your pregnancy. So from here on, it will be instructed to the patient if there are any other tests that will have to be done prior to conceiving. The goal is to make sure that the endpoint, a healthy mother and a healthy baby, is ensured.
Yes,
and during that time also, your family history can be reviewed, so you learn more about your cousins and your other relatives, and find out if you have along the line disorders or diseases that may be of concern in case you become pregnant. And of course, it's really just looking into your health history and preparing you for a safe and a healthy pregnancy.
And looking to your mom, they say, is that true? That how your mom was pregnant with you or your siblings, it's the same manner that you will handle your pregnancy, or that your pregnancy will be similar to hers?
Not always the case. It's,
Okay.
Maybe what would be applicable is if your mother turned out to have a certain disease entity, let's say hepatitis B. If she is a hepatitis B patient, then that will mean the offsprings will also be. That will make that patient probably at risk of having hepatitis as well. So there are many things that we can look into, but it doesn't necessarily equate to how your mom was. You'll also be the same. If your mom was a C-section, then you'll also be a C-section.
Yeah.
Not true.
Really? Okay. That leads us to prenatal care. Yes, prenatal care. We
Yes.
talked about preconception care. Now, prenatal care.
Now,
How does that go?
It's taking care of you when you become pregnant.
Already.
So as soon as you find out you're pregnant, come see us, visit us, and we will start with, of course, determining when you are expected, how far along pregnancy you are, and then we have a whole plan for you for the 3 trimesters of pregnancy, how often you need to visit, and the things that you need to do as far as diagnostics, scans, lab exams, and then supplementation.
Angel, if I may add,
Yes, doctor.
along with the preconception care, we advise our patients already to start folic acid. This is a very important supplement. It helps ensure that there will be good brain development. It should be started at least 6 weeks or 1 month prior to conceiving. It's because the first organ that develops in the baby is the brain alongside with the heart.
That's right. So folic care once
Yes.
you are pregnant.
Or intending to.
Intending, even when
Ideally,
Yes.
yes.
even when you're just intending to
Yes.
become pregnant.
So
Six
preconception.
Oh, yeah.
All right. And sometimes, others maybe skip the prenatal and preconception care. Does that happen?
Yes.
That they just skip it altogether and they don't think that it's important.
They sometimes would come in at a very late trimester or will not come at all and just come in already in labor.
Oh my. So
But
skipping
the-
all of that, which can keep her healthy and happy and the baby safe as
No
well.
battle plan for those patients.
We should always have a battle plan.
Yes.
I go back to that. Now we have another caller on the line, doctors. Genevieve. Hi, Genevieve. Good evening.
Hello, I'm Genevieve Gatbon. Hi, ma'am. I'm Genevieve, and I'd like to ask if the earlier stages of pregnancy may affect my baby, because I didn't take vitamins and those multivitamins milk. In these 5 months and 6 months, I was able to take frequently the vitamins and the multivitamins milk.
So, Genevieve, did I get that right? Did we get that right? The first trimester,
There was no supplement.
no supplements, no vitamins,
Yes.
correct? Genevieve.
Yes,
And then, second trim,
yes.
you already...
And at my 5th month and 6 months, I was able to take the vitamins and the milk.
Okay, thank you. Doctors?
I'd say, Genevieve, if you've been quite conscious about what you've been eating, if your diet was balanced during the first trimester of pregnancy, then that should be sufficient. But if you were a bit lacking in making sure that you're eating right, on top of that, if you have a medical problem, then in spite of having vitamins, but that medical problem was not taken care of, then it will not amount to anything. So it should be a balanced outlook when you're pregnant, not just supplements, but the general well-being.
Genevieve?
Yes, I was able to eat some nutritious food.
Good, good. When are you due, Genevieve?
I think in June.
Well, June. Okay, so she's
Okay.
second trimester already. So, any other question for our doctors, Genevieve?
I'd like to ask if some defects will happen if the earlier stages were not taken vitamins.
Genevieve, how old are you?
I'm 32.
32. And then, does your work entail having to be exposed to anything like chemicals?
Genevieve? Hello?
I'm not taking any chemicals.
Okay.
What work do you do?
What kind of work do you do, Genevieve? Genevieve?
I'm doing household chores.
Okay,
Okay.
alright.
And then you don't have any illness. You're not hypertensive. You're not diabetic.
No, ma'am.
No. Okay. If all of those are a no, you're not sick, you didn't take anything harmful, you were not exposed to anything bad, then in spite of the absence of your supplements during the first trimester, you should be fine. But what I would suggest is, it's not too late to go to your OBGYN and ask for a congenital anomaly scan, just to make sure that your baby is fine.
Yeah.
Genevieve?
Yes, ma'am.
Okay. Did you get that, what Dr. Rose said?
Yes, I think she's right.
Okay. Thank you. Thank
so
you,
much.
Genevieve. Have a healthy, happy, and safe pregnancy.
Take care.
Take care. Bye-bye. Thank you for calling. Okay, doctor, you mentioned eating right. I have to write that down. Eating right. What is eating right when you're pregnant? Do you eat everything and anything inside? Because the excuse is, I'm eating for 2. Are you really eating for 2?
You're not supposed to be doing that.
Yes.
Okay.
You're eating for yourself. We have to go by what is recommended. So a balanced, healthy diet where you have enough of the calories that will give you energy for whatever work you need to do for
How
the
many
day.
calories? I didn't mean to cut you, Doc. But how many calories for a pregnant?
You have an additional 200 to 300 per trimester over what is computed for your weight. And then, of course, you have some protein sources, a lot of calcium also.
It's more of not overindulging. Don't make an
That's
excuse.
difficult.
It's not supposed to be an excuse to eat too much or so much just because you're pregnant.
Okay, but we're talking about eating. So now
Yes.
let's go to myth number 1. Let's say this is myth number 1. You can't eat raw food when you're pregnant. Salad, sushi, anything raw.
That's true because raw food, whether it be sushi or steak that's done rare, or this local dish, it's called kinilaw.
It's really good.
Cause, yes, but it can cause toxoplasmosis. It's an infection that can outrightly kill the baby or make the baby look abnormal. So as much as possible, we try to shy away from that. The other source of toxoplasmosis would be cat litter. So for those who have cats at home as a pet, they can keep the cat, but just don't clean the litter box.
Okay. Dogs?
Dogs are fine.
Dogs are fine, okay. Myth number 2, not being intimate with your partner during the time that you're pregnant.
That's very sad.
Yeah, that's stressful.
Stressful. No, go ahead and enjoy each other.
There you
So
go.
pregnancy is not a reason to stop being intimate. No, of course, there will be a little spotting, maybe a little bleeding after the act, but don't worry, it's not going to harm the baby. Of course, if you have conditions like placenta previa, during the latter part of pregnancy, that's when the placenta, the afterbirth, is located in a low position. So your doctor will instruct you or advise you against sex during pregnancy. But otherwise, enjoy your relationship.
Okay, all right. And in enjoying, how about sleeping? You enjoy sleeping because you're pregnant. You're always sleepy. So do you lie on your side or do you sleep on your back? What is the best position when you're pregnant to go to sleep?
As early as 16 weeks, we normally recommend that you don't lie flat on your back. There's this major blood vessel, it's called the aorta and inferior vena cava. It's in charge of distributing all the blood flow specifically to your uterus. Now, if you're quite heavy already with a heavy uterus and it's impinged, then that blood flow will not go correctly to where it's supposed to go. So there will be a little bit of short changing on the oxygen going to baby. So we advise patients to turn to their side. They've been quite strict before. It has to be the left.
Why the left?
Because of the anatomy, the right side will have the liver and then the rotation of the uterus.
That's right.
But not anymore these days. The patient can turn to whichever side,
It's more comfortable.
whichever she's comfortable with,
Yes.
as long as it's not flat on her back.
Okay.
And not lying down flat on her tummy either.
Oh, no, no. I can't imagine
Yes.
lying
Yeah.
down on your tummy.
Yes.
Maybe the first trimester
Yes.
can,
But
but as you get bigger, then
No.
it's going to be very uncomfortable.
Very
right.
uncomfortable.
How about exposing yourself to X-ray machines, the microwave oven?
okay. The X-ray machine, depending on what part of the body you're trying to get an X-ray of, but the harmful level of radiation for pregnant women is more than 5 rads. The ordinary chest X-ray is way, way, way below that. So if the chest X-ray is warranted, the mother is ill, she needs to have that procedure, it will help clinch the diagnosis, then let her go for it. But more often than not, we do have abdominal shields that will help protect the baby.
How about walking fast induces labor? When you're on your last trim and you know you have that couple of days or weeks to go, they say you just have to keep walking and walking and walking to induce labor. Is that true?
Walking makes you stronger. It helps you build up endurance. But if you're not in labor, you know, you will get your feet sore and not go into labor, not improve as far as dilatation, even if you walk hours. But if you're already in labor, it can actually help,
Yes,
right?
it can augment.
Because some patients, when they're on their back or they're lying down in labor, they notice their contractions begin to wane or slow down. But when they're up on their feet and walking around, walking about, then they do better as far as progress of labor.
It's good to be active when you're pregnant.
Oh yes,
Yes.
yes.
Makes you stronger, and it does something to the body. No, when you're active, it also helps the baby, the position of the baby. Is that correct?
Not necessarily. Walking helps prepare the pelvic floor, the pelvic muscles in preparation for labor. Some would say that if the pelvis is good enough for labor, then that walking will help baby's head insinuate itself some more in the pelvic rim. But no matter how far you walk, but that pelvic rim is narrow, you might not still go into labor even if that's the goal of walking. But it is safe for pregnant women unless what Dr. Said, if you have a low-lying placenta or an abnormally located placenta or any other medical condition, then it's a case-to-case basis. But for a healthy mother, by all means, walk.
Okay. We're not walking away from this topic because when we come back, we'll talk more about maternal health when MedTalk returns.
Do you know that a pregnant woman is more likely to have bleeding gums and experience nosebleeds? Worry not. These are just manifestations of the many hormonal changes happening in your body, such as the increase of blood flow to your nose and mouth. Being a mother requires the right amount of preparation, dedication, and patience. But what happens if the soon-to-be mother is not yet ready to give her child quality care? From the year 2000 up until 2010, the number of women who became mothers at aged 15 to 19 climbed to 65%, according to the National Statistical Office.
During this age group, you can have problem of malnutrition. You know, you're not so healthy during those times. So teenage pregnancy could result to unhealthy babies, no? And of course, producing premature babies, no? And of course, this emotional pressure from the peer group when you're supposed to be studying and you have other concerns in life.
For Wian Panganiban Bermejo, life turned upside down when she became pregnant at 14.
Kasi nung time na yun, sobrang payat ako, pero maliit lang din yung tiyan ko. Actually, hindi ko masasabing mahirap, pero mahirap yung paglilihi. Yung labor, mahirap din.
This was soon followed by another baby at 16. At such a young age, she did not know that regular consultations with doctors plus screenings for possible complications were important for anyone who is pregnant.
Tapos before kasi nitong pregnancy na to, karoon ako ng problema sa ovary ko. Yun yung tinatry namin ng OB ko na i-work.
Today, at 27 years old and with another child on the way, Wian feels more confident, especially with doctors by her side right from the start.
Napaka-importante talagang parang every now and then pupunta ka sa OB. Siyempre, napaka-importante nun kasi kailangan mong vitamins, yung mga kailangan mo sa immune system mo.
We're back here on MedTalk, still talking about maternal health. You may join the discussion by calling our hotline at 548-4678. Doctors, Wian, mom at 14, 16, and then 27. When you're 14, you don't plan to get pregnant.
Obviously.
Yeah,
it's not part of your
battle plan. It's not part of your youth because you're still a baby yourself.
Yeah, the body's so young, ill-prepared for a pregnancy. And,
the most crucial time for a high-risk teenage pregnancy is 2 years after menarche. Menarche is when they start to have their menses. If they do get pregnant 2 years just after that, it's not going to be a very good outcome. Their pubertal age entails having good nutrition. How can they support a baby inside when their own nutrition is not even suffice? That's why it's high risk, because they will probably have a preterm baby or a growth restricted baby or fetal death.
Yeah. What are the health concerns of a teenage mother?
Usually it's anemia. And then they're not mature. So emotionally not prepared, obviously not financially. And they will have to deal with parents who are horrified by the thought of having a child pregnant.
See, the teenage pregnancy changes the life of the youngster, no? Affects her future, so education is set aside and she'll have to take on adult roles. So it's really, as you said, Herculean in the beginning. It's a big task for a very young person. And teenage pregnancy is becoming a problem for us here in the Philippines. As we noted, more than 65% rise during the last decade, and still rising. Actually, I think we're among the top as far as teenage pregnancy statistics.
Why is this? Isn't the information enough? Aren't our
be
teenagers
more
careful?
Yes.
It's a generation thing.
Also, maybe lack of education, guidance, sexuality education specifically, and also maybe the fact that the youngsters are, they have easy access to social media. Correct. And a lot of changes as far as their sexual practices and habits. So they get themselves exposed to, these things and get themselves pregnant. At a time when they should be in school.
Yes, they should be in school, and they should take note or understand the changes that are happening in their bodies, minus another human being. Because as it is, as a teenager, your hormones are all over the place.
That's right.
You don't understand what's going on, and to take on the big responsibility of becoming a mother, just like Wian, she was 14, she had her first child at 14, and then at 16, and then
27.
Properly guided, now 27.
Yeah, but I must hand it to her, because at the age of 14, she could have been tempted to do something bad, but she didn't.
Yes.
So hats off to her for that one.
Yeah.
She became responsible through the years.
And hats off also to the support system, which is very important. Her husband, the father of her children.
That's right.
all throughout. And we saw the children very, very cute, very healthy. Doctors, we have a caller on the line, another caller, Rachel Puno, or Rachel, did I pronounce that correctly? Hi, good evening.
Hi, good evening. It's Rachel Puno.
Rachel, hi Rachel.
Good evening. Yeah, I'm on my 7th month, specifically 30th week of my pregnancy. So I just had my checkup yesterday, and she told me na we were hoping for a normal delivery, pero parang malaki daw ako. And she wanted to make sure na I don't get bigger anymore. So as a mom, what can I do na para hindi na ako lumaki or hindi na lumaki yung baby para hindi ako masihe?
Okay, Rachel.
How much weight have you gained, Rachel?
I already gained the ideal weight, yung 30 pounds from yung total pregnancy.
30 pounds, okay.
And you just entered the 3rd trimester. Is that right? You just turned 7 months, no?
Yes.
This is also the time when the baby grows very fast, no? So they gain like about 150 grams a week, right, Doctora? And so what can we tell you? Eat healthy. Avoid simple sugars, have some physical activity, walk. And if you're not diabetic, non-hypertensive, well, the weight is going to add on because the baby is growing.
Yeah. The thing is, Rachel, pregnancy is not the time to go on a diet. Remember, you have a person trying to make use of what you eat. So it's more of a lifestyle change. You modify what you eat instead of, as Dr. said, banking on the sweets, the pastries, the ice creams. Well, you can't have those anymore.
Even just a bit?
No.
Okay.
Because she's really gained a lot. That's quite a lot. So it's choosing the protein because that's what your baby needs over the fats. So that we curb your weight gain a bit.
And basta more on sweet.
No more of the soda.
So I was blaming the food that I eat sa US. Baka it's too rich for me. Kaya lumaki ako ng ganon. I gained so much weight.
Yes,
the OB there told me na pwedeng mabilis ako na-gain ng weight, but on the last trimester, slowly na akong parang I won't gain so much anymore.
Okay. How about raw? At this the last trimester. Rachel, are you still on the line?
Yes.
Okay. Any other question? I just asked about raw food because the first trim and the second try to avoid, but the last trimester, just you mentioned eating healthy, maybe salads and
Yeah,
is that advisable? That will do?
As long as it's prepared well, okay. And you eat from a reputable restaurant.
Okay.
In spite of it being raw, but it's a good restaurant that prepares their food well, and that should be a reassurance for you.
Okay. Rachel?
All right. Okay. Nervous lang ako mag-CS, but thank you.
Okay. I understand. Salamat, Rachel. Oh, everyone wants a normal delivery. Yes. We were talking before we came on air about a pelvimetry.
Yes.
A pelvic exam, just so, like Rachel's concern, she's getting bigger. When is it advisable to get a pelvimetry to determine the size of your pelvis in relation to the size of your baby?
We don't routinely do X-ray pelvimetry anymore. The only 2 indications where we do X-ray pelvimetry would be if the baby is in breech position and the patient and the practitioner, the doctor, are considering planned vaginal breech delivery. But otherwise, X-ray pelvimetry also is done, and the other indication is when the mother has a history of pelvic injury. But X-ray pelvimetry is no longer routinely done. So what we do when you get to your 36th week or 9 months, you have an internal exam, and with that, a clinical pelvimetry. And there are dimensions in the pelvic diameters that we can actually measure clinically.
Okay, thank you, doctors. Now we have a question from Twitter. Can having STD or STI like herpes affect my baby? Dr. Rose?
Yes, it will. The herpes is categorized into two ways. Is it actively manifesting, or is it a recent or a past infection? A patient may have herpes in her blood, the herpes simplex virus, but not actually manifesting the lesions. More so if she has lesions, then that will dictate the quality of delivery and what the outcome will be. So simplified, her question is, will it affect?
Yes.
It will.
So can we prevent it from affecting the baby? Is there anything to take or apply?
There is treatment for the herpes simplex lesions, but that treatment will, and it's safe for pregnant women, but that treatment will not take away that virus in the bloodstream. It'll be there for life,
Okay.
but not actively manifesting.
And the fear of it being transferred to the baby?
Well, it's not always a hard and fast rule that it will be transmitted, especially if it's not actively manifesting.
Okay. Doctors, we will talk more about tonight's topic, maternal health, when MedTalk returns. We're back here on MedTalk, still talking about maternal health. Doctors, we were talking about the weight earlier with our last caller. And what is the ideal weight? Let's give an example. Like, for example, before you get pregnant, you are, let's say, 100 pounds. So all throughout your pregnancy, 9 months, how much should you gain?
Okay. So if you're 100 pounds and you stand 1.5, about 5 feet, 5 foot tall. So that's good enough body mass index, no? So the recommended weight gain would be a total of 12 to a maximum of 15 kilos all throughout pregnancy. It used to be, in the past, we would limit like 2 pounds during the first trimester, the first 3 months, and 11 pounds for the second trimester and another 11 for the last trimester. But now it's, so we say 12 to 15 kilos if you're starting with a good weight as against your height, so a good body mass index.
Okay. So you mentioned 2 pounds during the first trimester because there's a tendency for you to gain weight or to lose weight.
Yeah, some
during the first time, no?
Yeah, because of a lot of vomiting. No?
We don't anticipate much gain weight during the first trimester. That's when they don't feel like eating or they still have their nausea and vomiting. They do catch up during the second to third trimester. That's when they balloon.
That's when their body's more adjusted.
Yes.
And they understand
enjoying
what's
their
going on.
pregnancy.
And they're enjoying their pregnancy and enjoying their food. Doctors, let's talk about screening. Screening tests like pap smear or tests for breast tenderness. Is this routinary? Can we skip this? How important is it?
Those that you've mentioned, the pap smear and the breast tests, usually are better done before conceiving. Ideally, you prepare the home of baby, which is the body of the mother. So these tests should be done prior to conceiving. Not that it'll expose the mother to any radiation if the breast test was done. Along with these screening tests, if the mother is already pregnant, we have a basic prenatal panel of tests, and that would include your CBC, your urinalysis, your blood type, an HBs antigen screening test, among others. And those are for patients who are at low risk. Low risk would mean they don't have any illness whatsoever. Anytime that you pick up a patient during her prenatal checkup, the first one, and you can conclude that this patient might be high risk, then that'll entail having to do more tests on top of what I've just mentioned. There will be screening. Let's say this patient you showed, she was 41, the one who rang a while ago.
Yes, doctor.
She's 41. We need to make sure if she's amenable to it, to screen for the likelihood for preeclampsia, the likelihood for aneuploidy. Aneuploidy would mean your mongoloid or your trisomy. There are tests now available that can be done to a patient as early as first trimester to prognosticate.
Okay. And how often should we see our OBGYN when we're pregnant?
If it's a low-risk pregnancy, come as soon as you know that you're pregnant or you're suspecting pregnancy. As soon as you miss your period, please come and see your doctor. And then usually it's every 4 weeks during the first 3 months. But now there's a lot of talk of actually reversing the pyramid of prenatal care, where some obstetricians are actually advocating that we see our patients more often during the early part. But traditionally, it's still every 4 weeks or every month during the first 3 months, and then every 2 weeks starting from the 3rd trimester.
Doctors, how does one prepare herself for a happy, a healthy, and safe pregnancy, physically, emotionally, mentally?
Let's start with financially.
Okay. Oh, yes.
Because you were discussing a while ago about teenagers. Well, they're in every aspect, a teenager is never prepared emotionally, physically, financially. So for a patient to ensure a good outcome, she has to examine herself first physically, and to examine if she has any vices that might pose harm to the outcome of the pregnancy. If she's a smoker, if she's into drugs, if she has any medical illness that might have to be controlled prior to conceiving. The other is she emotionally prepared? Does she have the capacity to carry a pregnancy the whole 9 months yard? Will her work allow it? Things like that. When she's prepared in all aspects of it, then that'll mean she's already ready to embark in the pregnancy.
Thank you, Doctor. Doctor, any final words, tips to all our viewers who are pregnant and who want to get pregnant?
Okay, go to your doctor for your regular prenatal checkup. I'm sure your doctor will be more than happy to ensure that you and your baby are healthy. And pregnancy is not a disease. There's going to be a lot of things going on, but your doctor will be there to assure you that everything is all right after she has assessed you.
Thank you very much. Oh, yes, Doctor, you'd like to add something?
Oh, I was just going to say that you should always consider pregnancy as something that is a huge responsibility. I always remind my patients, you don't become a mother upon giving birth. You're already a mother as soon as you're conceiving. So the responsibility is already there, which will mean once you've decided to conceive, you should already be starting your folic acid, among other things.
Okay. Among other things, I remember during the start of the show, you mentioned you must have a battle plan.
Yes.
You must have a plan of action. And thank you very much for enlightening all of us, our viewers, about that plan of action and how to have a healthy, safe, and happy pregnancy. We'd like to thank Dr. Rose Castillo-Cheng and Dr. Manny Reyes for enlightening all of us about maternal health. See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.